So the next speaker we have that's on the same subject is Dr. Kevin Keegan. Dr. Keegan was a professor at University of Missouri, and he's done a lot of work, and actually he's kind of the pioneer of this technology. So we are trying to show folks that are doing newer things, because we're still trying to learn how to help these animals so that they don't have a problem. And I like these new types of technologies because it'll help us in the field make it better for the horses. So with that, I'd like to pass it over to Dr. Keegan.
Okay, thanks. So I'm going to present some inertial sensor data that was collected at thoroughbred racetracks in Ohio and Iowa. But first, even though Dr. Fenger and Dr. Bell have done a little bit of it, I'm going to first speak about how the system works and specifically how it was developed to give an appreciation for the validity. Oh, and I first have to correct something. Dr. Bell did his surgery residency at Missouri, not at Ocala. We want to claim that. So you don't mind I did that, do you?
No, I meant to say.
Okay. All right. So this system that Dr. Fenger and Dr. Bell have already alluded to was developed in the late 1990s and early 2000 as a lameness detection and diagnostic aid for veterinarians. So it was developed only after we first investigated whether such a system could in fact be beneficial to veterinarians by assessing the current state of the art, which is subjective evaluation. And by the way, all of this is published in case you wanted to look it up in many peer-reviewed publications, but the consensus was that simple subjective evaluation by observation of the horse in motion is barely suitable, and that if it could be developed, then a more sensitive measurement system at detecting lameness would be beneficial to the profession. So the first step was to pick a technology. So should we measure, for instance, movement, or should we measure ground reaction forces, or should we measure something else? So for various reasons, mostly because we know or we've figured out that lameness as a clinical sign is actually quite variable. And you're going to need to collect a lot of data for many different strides. And also that this method necessarily, if it's going to be useful, is going to have to be used in the field. We settled on measuring body motion instead of ground reaction forces. We just thought that the engineering and development that would be required to measure ground reaction forces on all four limbs in the field was just too high a bar to get over. So, and we didn't know what to measure. So we settled on motion analysis, but we didn't know what to measure. There are potentially many different things that one could measure. For instance, you could look at stride length. You could look at how the limbs swing. You could look at joint angle changes. So we started from scratch and started measuring everything by putting markers all over the horse's body. And we used computer-assisted analysis of gait on horses with known lameness. And also all of this is published in over the last 25 years using various data mining techniques, looking at the complete data collection. We basically found out that vertical displacement of the pelvis and vertical displacement, or you could say vertical position also, vertical position or displacement of the pelvis and vertical displacement or position of the head are the most sensitive and accurate indicators of lameness. Also the most accurate and sensitive indicators of which limb is the source of lameness, not position and not level in the limb, but which limb. And also when we found out this later through additional investigation, the most sensitive and accurate indicators of the timing of lameness, and Dr. Bell and Dr. Fenger have talked about impact and push-off lameness. Basically, vertical displacement of the torso, the midline of the horse, was the signal that had the best information to for detecting lameness. This is why we put the sensors where we do. So we didn't just wake up one day and we didn't just wake up one day and decide to put accelerometers on the head and pelvis. First, there was an investigation of where is the best place to put them. Incidentally, we've tried the same approach to come up with accurate parameters to detect lameness in the horse when cantering and galloping, but so far we have struck out. Despite a few NSF supported studies and a Grayson supported study, we have basically struck out. We can detect lameness at the trot in the horse very easily, even subtle lameness, but so far at the gallop, we cannot do that. And it seems that when the horse is trotting, it has many mechanisms to shift weight around due to pain, and this is what can be picked up. But when the horse is galloping or galloping or cantering, it is forced into a certain gait signature that is difficult to change. So this is why we measure vertical acceleration of the head and pelvis. As you note, I indicated that the measures for lameness are positional, but we measure vertical acceleration. Okay, I'll explain that a little bit. I'll explain it more in a little bit. But we so all of the information about the lameness comes from the head and the pelvic accelerometer. There's another sensor that we put on the right forelimb, but that's just a time index indicator. It just indicates where we are in the stride. It just provides a method for indicating the start of the stride. Incidentally, we can now do that by using the gyroscope on the pelvic sensor. When the horse is trotting, the pelvis rotates in a certain way, and we can identify the footfall sequence just by looking at the pelvic rotation. And this might be useful, for instance, if thoroughbreds on the track, when maybe putting that right forelimb sensor on would be not practical. So vertical acceleration, then, this is what we measure, is converted to vertical position. You simply cannot measure position accurately enough, like directly. You could use GPS, but GPS is not accurate enough we need sub-millimeter accuracy, and GPS is maybe 5 to 10 centimeters. So we need sub-millimeter accuracy. So we convert from acceleration to position, and converting acceleration accurately to position is not really a very simple thing to do if you understand that. The Q with lameness locator uses a unique method that was developed by a mechanical engineer at the University of Missouri. And if you're interested, this has also been published in engineering journals, but it is a specific method that we use. Okay, it might seem that it would make more sense to actually measure and then report acceleration as the measure of interest, since acceleration is directly related to ground reaction forces. But raw acceleration is noisy, and it is greatly affected by how you mount the sensor to the horse. It has to be mounted intimately to the horse so that it moves basically up and down the same way that the horse does. And then acceleration has to be smoothed in order to pick out useful features. And the method that one uses to smooth the acceleration is important, and its accuracy will depend upon how good that smoothing method is. And it also affects the meaning of the features that you extract from the signal. So I plotted up here, this is just a raw acceleration signal of the pelvis in a horse over 2 strides. And you can see that it's squiggly, okay, squiggly, so it's noisy. So where, for instance, would you pick in this trajectory, where would you pick a repeatable and valid maximum? And it's very difficult. So you have to smooth the acceleration to get position. So vertical movement of the head and pelvis in a theoretically perfectly not lame horse would be a sine wave-like signal, which is the upper plot. So up here, okay. So in a theoretically perfectly not lame horse, it is symmetrical. And the pain during the stride cycle is a defect. And this defect perturbs this perfect sine wave-like movement. And then when you add them together, you get the asymmetric vertical movement. And we measure this perturbation in the symmetry as lameness, as a metric of lameness. Okay, because of some subtle biomechanical differences, Dr. Bell alluded to them a little bit already, in the vertical movement of the head because of forelimb lameness, compared to vertical movement of the pelvis because of hind limb lameness, we distill this asymmetry as a measure of lameness down to a single measure for forelimb lameness, which we call the vector sum. It's a combined measure. It's not the simple sum. It's a Pythagorean sum, but we measure vector sum, and this is a combined measure of the differences in the high heights and the low heights of the head that occur at each half cycle of the stride. And then we distill the hind limb measures down into, or the hind limb lameness quantification into two measures. One is diff max pelvis, which is the difference in the maximum heights of the pelvis, which is the push-off component of hind limb lameness, and then also diff min pelvis, which is the difference in the low heights of the pelvis, which measures the impact component of lameness. Okay, these are measured for every stride, and then an average over all the strides and a standard deviation over all the strides is calculated and displayed in these plots. Dr. Bell and Dr. Fenger have shown some of these already. This is a forelimb lameness plot here. Every blue line is a stride. The length, which is the vector sum, is proportional to the amplitude of lameness, and that red line in the middle is the average over all of the strides. The direction into which the line is pointing indicates the side and timing of lameness. So up is right forelimb, down is left forelimb. And as Dr. Fenger and Bell alluded to already, an approximate range that is equivalent to a horse judged to have no forelimb lameness, a score of 0, is plus or minus 8.5 centimeters. We've compared this as a subjective evaluation, which is the radius of that gray circle. It's actually 6 millimeters because of it's a vector sum. Vector sum is a vector sum of diff max head and diff min head. So that's what the radius of that gray. So lines outside that radius are abnormal. Okay. These are the hind limb plots. One for the left hind limb, one for the right hind limb. Red lines up indicate decreased thrust or decreased rise of the pelvis, and that is a measurement of the push-off lameness on that side. Every red line up is a stride. And then green lines down indicate a decreased fall of the pelvis. That's the impact component of lameness. An approximate range that is equivalent to a horse judged to not have a lameness or an AAP score or score of 0 is plus or minus 3 millimeters. And as Dr. Bell indicated, these are the thresholds that we use when we are examining horses for lameness. So it's purposefully sensitive threshold to avoid false negatives in horses that have a complaint of lameness. Okay, so they come in with a complaint of lameness. However, we realize that many horses without pathology will exceed this threshold for at least one of these measures, at least occasionally. And a more appropriate threshold, as Dr. Bell alluded to, for a more general screening of horses without existing complaint of lameness, we established as 18 millimeters for vector sum and 7 millimeters for diff min pelvis and diff max pelvis, which he's already indicated. And this was established in a couple of different ways. It's one standard deviation of these measures from a large number of sample horses. It's also the 90th percentile of the absolute difference between back-to-back trials, again, in a large number of horses that are not supposed to be lame. So basically 90% of a group of horses that have no history of lameness will have trial measures that will differ by less than this amount, back-to-back trials. So it is a wide repeatability estimate, understanding that lameness can be variable from trial to trial. Okay, now I'm going to present data which has now been collected at 2 Ohio racetracks and 73 horses over 16 weeks of racing, and 1 Iowa racetrack on 36 horses over 18 weeks of racing. 79 of these horses were evaluated at least 5 consecutive times. In the Ohio study, it was weekly. In the Iowa study, it was every 2 weeks. All horses were evaluated with the handler leading the horse at a trot with the lead shank. Care was taken to collect data from at least 19 contiguous strides. It's important, in 2 separate back-to-back trials while the horse was trotting back and forth on a firm flat surface. And this is very important to understand or to realize these evaluations were all performed during the week in between races, not right before the race. And the first take-home realization that we found was that measured lameness in racing thoroughbreds is common. And using these estimated thresholds of serviceable soundness of 18 millimeters for vector sum, 7 millimeters for diff max pelvis and diff min pelvis, many horses will measure with at least one of these measures outside of this range. So it is a characteristic of this type and use of horse. So I'm now going to show a series of plots that were collected in the Ohio study on individual horses and their lameness measures throughout the study. So the x-axis, this is similar to the plots that Dr. Fenger has indicated or that showed, but the x-axis here is time in weeks, and the y-axis, and there's 3 plots. The y-axis are the amplitude of the lameness measures. The top one is for vector sum for forelimb lameness. That's the uppermost plot. The middle plot is diff max pelvis. I get the diff max and diff min flipped from what they had. But the middle one is the diff max pelvis, which is the push-off component of hind limb lameness. And then the lower one is the diff min pelvis, which is the impact component of hind limb lameness. So each horse's measurement throughout the trial is shown as these little blue dots or red dots. I'll explain big red dots. I'll explain what the big red dots mean in a second. And they're connected by this blue line. And instead of the threshold, which is similar, but it is presented over this light gray background. And this light gray background is actually all of the measurements that were collected, the total range of measurements that were collected from all of the studies throughout the entire study. And it gives you an appreciation for this individual horse's measurements in relationship to all the rest. Okay. So, and then each plot has a 0 line here in the middle, and measures above that 0 line indicate right limb involvement. Measures below that 0 line indicate left limb involvement. I've also put in these vertical lines here are the dates that the horse raced. And it's not important for what we're going to talk about, but the finish and the speed index for that race. And I've also dropped in for all of the horses. I'm only going to show some of them, but I've dropped in the medication dates and treatments given to the horse. For example, this horse had its hocks injected between weeks 12 and 13. So now I'm going to toggle through a few horses here. So I'm sorry, the red dots are the measurements that are outside those thresholds that I mentioned to you before. So you could say the red dots are the horse measured with lameness on those dates. So I'm going to toggle through several horses, but you can see that it was common in just about every horse. It is common to have at least one measure outside of that threshold for soundness. It's common. It's not always, but it's common. Okay, so pretty common. So now I'm going to talk about individual horses. So, so look at this horse here. Every diff max measurement, diff max pelvis measurement, which is push-off component of hind limb lameness in this horse after week 9, indicates left hind limb lameness, every measurement. And this horse actually was rested at this time. Maybe the measurements actually assisted in the management of the horse, but it was found to have a tibial stress fracture. And then it was rested for some time, and then it raced the next year and had 11 starts. Okay, here's a horse that had 3 consecutive measurements of right forelimb lameness, right here, from weeks 9 to 12, and then the horse became normal. It returned, the measurements returned to below threshold for the remainder of the study. Here's a horse in which almost every measurement indicated right forelimb lameness, sometimes with and sometimes without a right hind limb lameness. So almost every lameness measurement in this horse indicated right. Okay, here's a horse that started out with a strong left hind limb lameness at week 1. Then it switched over to a strong right hind limb lameness in weeks 2 through 4. And then it maintained a above the threshold right hind limb lameness during which time it didn't race. It was racing around these dates, but it didn't race in these dates. And then it kind of switched over to a minor, or you could say mild left hind limb lameness, because it's still within the threshold for the remainder of the study. And here's a horse that maintained a left hind limb push-off lameness throughout most of the study. And then it had its front ankles injected, and then it became normal. So maybe that was compensatory lameness. So you go figure that one out. So in fact, in this Ohio study, using those previously mentioned thresholds of 18 millimeters for vector sum and 7 millimeters for diff max pelvis and diff min pelvis, just over half, or 50.7%, of all the trials collected had at least one of those 3 lameness measures above the threshold. So measurement of lameness was common. So to give you an appreciation for how common this is, or how you could say lame overall this is, for comparison, I calculated the same measure, the percentage of trials outside this range for a random sample of 100 horses that came into our clinic with an expressed complaint of lameness or poor performance. So they say it was anticipated that these horses had some musculoskeletal disease and we needed to find it. Okay, so approximately the same percentage of trials, just over 50%, 53.6% of those trials were above that threshold. So thoroughbred racehorses in between races as a whole, at least in these 2 tracks, measure with lameness about as often as one would expect for horses that are presented for veterinary examination of lameness. This is the Iowa study, which we actually found the data was a little bit more variable, was a little bit lower, but 29.5% of all of the trials that were collected had at least one of those measures outside the range. So fortunately for the horses in the study, and also racing industry, you could say, but unfortunately for trying to determine association or cause and effect, there was only one horse in all of these studies, the Ohio and Iowa collections, that had a catastrophic breakdown. That's this horse right here. It measured intermittently with a combined right forelimb and right hind limb lameness. I'm sorry. It measured intermittently with a right forelimb and a contralateral left hind limb lack of impact. But occasionally you could see it measured below threshold in all of the measures. Okay, so sometimes it was measured, sometimes it wasn't. Okay, it had its forelimb ankles injected about 1 week after the study, raced 3 more times over the next 2.5 months, and then it suffered a biaxial mid-body sesamoid fracture in the first turn of the race, and then was euthanized. But the injury was in the left front, not the right front limb. So you can see the relationship between measurement of lameness and injury is not simple. I showed these slides last year as that if one wants to construct a causal model, including lameness and pre-existing injury in the model, we even today, don't know if lameness is simply a proxy, or you could say substitute measurement for injury, as this flow chart shows, or maybe lameness itself is a mediator or direct cause of lameness. We don't know this. Okay. So it's very easy to claim retrospectively after the fact that this intermittent lameness character, and that this is the horse that had a catastrophic musculoskeletal injury, that this particular lameness character in this horse, which was an intermittent forelimb lameness, is a harbinger of doom for this horse. And that if we only knew this ahead of time, that we could have prevented this. But this is really cherry picking. And this is one lone case. This is the actual video of the horse pointing to the measurement on the plot. But look here. Here's a horse with a similar measurement history. Actually, you could say it's worse because it has intermittent right forelimb lameness. And then it went on and raced after this 18 times the next year without incident. So here's a horse with a very similar signature, you could say, and had no problem. So to summarize, it is common for active thoroughbred racehorses to measure with lameness, and measuring thoroughbred racehorses for lameness on a one-time basis, as Dr. Fangerl already indicated, for the purposes of screening that horse on whether it's fit or healthy enough to race, is going to falsely exclude too many potential entries. So it is especially bad to do this on race day, on the day of the race when there's a lot going on, the horse is excited, and there's not enough time to properly evaluate what the meaning of that measurement is. So instead, it makes more sense to evaluate the horse regularly by measurement in between racing and training days, when lameness is more likely to be expressed. And also you have time to properly evaluate what the meaning of that lameness is, which is going to include physical examination of the horse, limb evaluation, and good quality imaging. It remains that we still, as a profession, need to identify those patterns of lameness expression that are actually associated with future injury, but we have to collect a lot more good data to do this. Not just the lameness measurement data, but also the injury data. And also, it's not going to be a simple one-size-fits-all assessment either, because the meaning is going to vary depending, for example, on the level of quality of the horse. And it's going to be part of a complex equation that's incorporating multiple factors that we already know are strongly associated with racetrack breakdown, and that's class of race, track surface, previous history on the vets list, etc. So I would like to wrap it up, trying to dispel some what I consider critical misunderstandings. I think I call them measure phobias on being against measuring lameness for horses with inertial sensors. And the first phobia, which is a combination, I think, of fear and pride, is that I don't need to measure the lameness because I'm so good at picking it up subjectively. Even if this were true, it's totally missing the point. And body-mounted inertial sensors are simply more sensitive and resistant to bias than subjective evaluation. But that's not the only, and it's not the most important feature of using them to measure lameness. Measuring lameness can confirm what we already think, so it increases confidence. It can protect against making a mistake because of distraction. It creates a quantitative record that can be stored and transmitted between important individuals. It makes comparison between dates more accurate, between people more accurate, and it can help decipher sometimes the complex relationship between the primary lameness, the compensatory lameness in the other half of the other part of the body. And so for our profession, it creates a database that we can in the future search and analyze for patterns that we may figure out someday that are useful, and that's going to advance the profession. So there's a wonderful article in Scientific American. This is just the picture in that article that explains why, at least in the human medical profession, why doctors sometimes reject tools that are going to make their lives, their jobs easier, using a historical review about the thermometer to give you, it's a very good read, but the thermometer was objected to in its early presentation. So, and if you're interested, there's a link on the right to that article. It's a very good article. The second phobia is that it's just too difficult to get the data, and the veterinarian doesn't have time to do this. But it only takes 2 minutes to instrument the horse, actually less than 2 minutes. And you don't have to be an expert to do that. You just put the sensors on the horse. What takes the time is the trotting of the horse back and forth, not putting the sensors on the horse. People say that, this is just too difficult. I just don't see that. It could be that thoroughbreds are too rank. I don't think so, but and that's why I'm showing these videos. Maybe they're too rank. I've been told that they're just too rank and difficult to handle on the lead shank, but I don't think so. And the results of our data collection don't support that, the trial by trial and stride by stride variability in the Ohio and Iowa studies are generally in line with what we have for other breeds and ages of horses. Perhaps you do need a more experienced person trotting the horse back and forth, but you can also collect the data when the horse is trotting under saddle, perhaps like when the horse is going out to train anyway. As I said before, we can remove that right forelimb sensor and establish footfall sequence by using the gyro on the pelvic sensor. It might be more relevant within thoroughbreds at the track to instead evaluate the horses out on the track jogging, maybe the added weight of the jockey, increased ability to control the excited horse, and then the ease of getting many strides. You don't have to have someone trotting up and down with the horse. All of these things make this method or this way of collecting the data on a regular basis more attractive. The range power and wireless connectivity possibilities for these sensors will easily allow that. And the last phobia is that this method of lameness measurement that is based on quantifying asymmetry will not detect bilateral lameness. But and bilateral lameness is common in thoroughbreds. Although in theory, bilateral lameness is more difficult to pick up, but it's more difficult to pick up both subjectively and objectively. And it's going to be less difficult to pick up objectively because the sensitive measurements are more sensitive. So this is really a straw man argument. Although it is true theoretically, it's not actually true in practice. So people think that critics of using this method of asymmetry measurement, they have this feeling that horses with bilateral lameness are exactly the same on each leg on every stride. But this hardly ever happens. Lameness as a clinical sign is not that consistent. It's much more variable than that. And if you're going to be measuring many strides, sooner or later that asymmetry is going to be picked up. And of course, you can always lateralize the lameness by moving the horse in circles or even small circles. And also lastly, because the horse is a quadruped, bilateral lameness in one half of the body can cause compensatory movements in the other half that you can measure. So I end by saying pretty much the same as I said last year. Lameness can be measured accurately and sensitively with body-mounted inertial sensors without much interference in the normal regimen of racing and training. Measuring lameness adds benefit because it takes away doubt and it takes away difference of opinion. It's certainly better than just eyeballing it. Objective data from large numbers of horses can be collected, analyzed, saved, studied, transmitted between individuals. The question on whether or not measuring lameness can help minimize the incidence of CMI, catastrophic musculoskeletal injury, is not answered by these pilot studies that we have done. because I don't think we really know what the association between lameness and injury is, but we have to study that. And if they are associated, if lameness and CMI are associated with each other, in my opinion, the best way to do it is to measure it with body-mounted inertial sensors. I'd like to thank people the organizations who supported the study, and also the people, veterinarians who collected the data, which was quite a lot of work. Thank you.